The Mississippi Department of Health held its first state board meeting of the year, announcing some new achievements and addressing some of their top health concerns. Here with more on those concerns and legislative priorities for this year, the department's executive director and state health officer, Dr. Dan Edney. Thanks so much for joining us today. I wanted to talk a little bit first about the nationwide rise in cases of pertussis. Why do you think cases are on the rise right now?
Well, we are seeing a nationwide trend towards fewer vaccinations among our children, especially 0 to 24 months. Those rates have been declining, and as we watch the population levels of immunity decline, then we're going to see a resurgence of vaccine-preventable diseases among our children, such as pertussis, which is whooping cough, but also diphtheria, polio, mumps, measles, rubella, things of significant concern.
Right. Are you seeing cases on the rise here in the state of Mississippi?
With pertussis, we are, but it's matching and trending along with the national trend is doing.
Right. And I know a few months back there was concern too about rising cases of walking pneumonia cases. Is that still the case right now?
Thankfully, that's better. That's related to an organism called Mycoplasma, and those cases have gone down. We're right in the middle now, though, of our respiratory disease season, which is influenza, COVID, and RSV. And RSV has been particularly a problem for our children. And we've already had at least 2 RSV deaths among children. So we're really encouraging families to make sure those children who are eligible for vaccination or passive immunity, that they talk to their pediatrician, family medicine doctor about getting that coverage.
Right. Also at the meeting today, legislative priorities heading into the new year were discussed. Could you brief us through some of those?
Sure. Probably our number one priority is to recognize community health workers as certified perihealth professionals, especially in the public health workspace, to help us really mitigate the severely low population health outcomes that we have, especially with heart disease, cancer, and accidents. Diabetes, obesity, hypertension are killing way too many Mississippians. We continue to lead the nation in preventable deaths, which is probably my number one concern as state health officer, is just the excessive amount of death that we have that's absolutely preventable, that reduces our life expectancy to the lowest in the country. We are seeing some improvements. We're making some progress along those fronts, but we have just an awful lot of work to do. And we need workers like community health workers to help us get this work done. We're continuing to lean into maternal infant mortality mitigation. We had approved yesterday the obstetrical system of care for us to begin constructing that to help facilitate transfers of high-risk maternity cases in the rural areas of the state, to get those high-risk moms and babies to the right level of care, to improve their outcomes and reduce the amount of excessive death that we're seeing in pregnancy and in 0 to 12 months. And we continue working hard on the front with syphilis. That remains a very high priority. Unfortunately, Harrison County is one of our hotter spots for syphilis in the state, and we have been making significant investments, especially in Harrison County, as well as our other coastal counties, to try to mitigate the amount of syphilis that's bleeding over into the neonatal population, causing congenital syphilis, and also contributing to infant death. And we are seeing progress, but have been very, very happy with the work occurring down in our coastal counties.
All right, Dr. Edney, we thank you so much for being here today, and sounds like the state is making some good strides in terms of those concerns.
Great, thank you.
All right.